Pediatricians are drowning. Between rising behavioral health demands and the constant need to document every encounter, the weight of administrative work is collapsing practices. To solve this, major EHR vendors like Epic, Oracle, Office Practicum, and athenahealth are marketing artificial intelligence as the ultimate cure for physician burnout. For practice owners, the challenge is figuring out which of these features actually work right now, and which ones are just concepts sitting on a vendor's future roadmap. Here are the 6 heavily marketed promises of pediatric AI: ambient notes, inbox disposition, patient messaging, referral automation, vaccine detection, and chronic outreach. In reality, those bottom 3 workflows do not exist as true AI today, and the top 3, they require heavy caution. Right now, the only proven, widely available benefit is ambient documentation, but it brings hidden financial costs and a surprising amount of user interface friction. Adopting pediatric AI today means you are trading the physical exhaustion of typing for entirely new cognitive and financial taxes. Native ambient scribes, like Epic's ART or Office Practicum's OPI AI, are designed to listen to a room. In a complex pediatric visit, they have to distinguish between the doctor, the parent, and the child talking all at once. The measurable outcome is solid. These tools automatically draft structured SOAP notes, saving providers roughly 2.8 minutes of charting time per visit. This chart maps out a tool's clinical impact against the effort required to use it. Ambient scribes sit in the upper right quadrant, high impact, high input. Generative AI produces probabilistic output. It doesn't transcribe exactly what was said, it predicts the most likely words. That means the system can hallucinate. Users report instances of the AI inventing a parent's name and placing it into the medical record. The operational burden shifts. You are no longer typing in the evenings. Instead, you spend time rigorously proofreading generated notes to protect your medical license. Ambient AI restores your ability to maintain eye contact with patients, but it demands constant vigilance to catch those inherent predictive errors. There are 2 tiers of AI documentation. Basic, standalone AI requires you to copy and paste text into your patient charts. Deeply integrated AI does the heavy lifting, routing discrete data directly into the correct EHR fields. Deep integration allows for single sign-on and lets you queue up lab orders and prescriptions using your voice. Moving to integrated features requires a total infrastructure shift, forcing your practice onto a cloud-based server. Vendors price this at a premium. Office Practicum integrated tiers cost nearly $200 monthly per provider. Epic requires enterprise licensing, stretching into the millions. A few vendors like athenahealth include certain AI tools for free in routine updates, but those are generally restricted to ambulatory care settings. Beyond note-taking, vendors are rolling out operational AI tools to manage your inbox by drafting replies to patient messages and suggesting billing codes. Activating these features creates a click burden paradox. Tools meant to save time end up cluttering the user interface and making navigation incredibly dense. Clinicians complain that simple tasks, like sending a basic medication refill, can inexplicably require 10 or more clicks through the new AI prompts. These heavy computing loads also lead to system instability. Users frequently report the software lagging or freezing entirely during high-volume clinic hours. Paying the premium for deep integration buys advanced routing features, but they come wrapped in a heavier, slower, and more frustrating daily interface. Marketing materials highlight advanced pediatric workflows. They promise systems that automatically identify vaccine gaps, track multi-step behavioral referrals, and execute chronic disease outreach. The goal is proactive population health, an EHR that works in the background to automatically close patient care gaps before they become urgent. However, these tasks rely on data outside your EHR, like fragmented state vaccine registries or external insurance portals. AI cannot yet navigate these disconnected systems. Because AI can't bridge those gaps, automation stops at a simple alert. Staff must still log in and manually clear the jam. In reality, most tools are just standard reporting and recall functions given a new AI label. They don't fundamentally change how data is processed. Today, identifying overdue immunizations or tracking down a specialist referral still requires heavy staff intervention, manual data pulling, and time spent on the phone. Relying on a 2026 EHR to autonomously manage your pediatric population health will leave you disappointed. Until these systems can natively navigate external networks, that level of automation remains vaporware. So where does that leave you? AI today is an incredible digital transcriptionist. It is not an autonomous practice manager. This flowchart lays out a framework to determine if your practice should adopt AI right now. Start here. Are you drowning in daily notes? If yes, and your EHR is cloud-based, you should activate a native ambient scribe. This path makes sense for high-volume pediatricians running modern cloud platforms like Athena 1, OP Cloud, or Epic. But look at this alternate path. If you are exploring AI to fix operational workflows like vaccine tracking and referrals, hold off. Practices expecting AI to solve front office logistics, or those unwilling to migrate from legacy on-premise servers, won't see a return on investment yet. Do not buy a software package based on a roadmap promise for 2028. Invest today only if the immediate return of an ambient note-taker justifies the real financial cost and the clinical friction you will experience tomorrow.